First, I introduce myself to the patient. Hi, I'm Zach. I'll be doing a head-to-toe assessment on you. I ask for your name, where you are, and what the day is. I listen to his affect to see if he has flat affect or how it's sounding. I look at his general appearance, if he's kempt, if he's dressed appropriately. Next, move on to his head. Take off the hat. I check head shape, see if it's normal lymphatic. Check hair for if it's brittle, if it's greasy. Check if there's lice, nits, or any other features. I check to see if he has any pain in his head, and if the scalp is at all damaged or crusty. Next, I move on to his eyes. I check his eyes to see if there's pupils equal round and reactive to light. I check to see his conjunctiva to see if it's pink. I check his eyes sclera to see if it's white. I ask if he has any problems with his vision or if he has any difficulties recently. Next, I check the nose. I check to see if it's midline to the face. I check patency of each nair, asking them to blow out each one. I check the inside to see what color it is. I'm on your nose.
Oh.
And I check to see if how much is in there. I ask if they have a deviated septum, if they have any pain in the nose, or if they have any trouble smelling. Now I move on to the mouth. Have you smile quick? Then that way, yeah, I can check to see if it's equal. I have them open the mouth. I check their teeth. I ask if it is their teeth. I look at the back of their throat to see if there's any redness or swelling. Check the moistness and the color of the mouth. Smelling. I have them stick out their tongue to see if it's midline or.
I smell the bread.
Now I'll go on to the ears. I check each one to see what color it is. I want it to be pearly gray. I check for the amount of cerulean drained in each one. And then I ask if they have any hearing problems, hearing difficulties, if they have any wax or drainage. Also for the nose, I ask if they're having any congestion or if it's draining a lot. Next, I move on to the neck. I have them turn their head to one side to check for jugular vein on that side, and also check on carotid, then do the other side to check jugular vein, and then check the carotid for the pulse. I feel for the lymph nodes to see if any of them are swollen. I check to make sure the trachea is midline. Ask if they have any problems with turning their neck, any pain, difficulties with that. Next, I listen to their heart. I listen to the apical pulse for a full 60 seconds. I check to make sure there's no irregularities. I check to see if like S1, S2, no skip beats, no murmurs, and then I ask if there's any pain anywhere, and if so, how, if it's radiating. Then after that, I listen to the lungs.
I can count their respiration.
I listen to a total of 8 spots on the front. And then after I'm done on the front, I ask them to lean forward, and I can check their back. Listening to the back and make sure the airways are open, see if there's any abnormalities. I'm breathing, I put my hands around here, so that when they breath, I see if the breaths are bilaterally equal. Ask if I have a cough, if it's productive. I ask if they have any drainage and they have any mucus drainage or any productive sputum, and if so, what the color is. If they have any pain with breathing, or if they have any difficulty with breathing. Next, I check their stomach. First, I check its general appearance, round, concave, flat. Then I listen for each one to see if it's hypoactive, non-active, hypoactive, onto each quadrant.
Ask about nausea.
After doing that, I palpate it, asking if they have any pain or discomfort while doing so. And then I also ask if they have what the recent bowel movements they've had, if they have any issues with bowel movements, or if they have any other discomforts in that area. Next, I move on to the other half. If they have when was the last urinary movement, what color, how often, and what was the smell of it.
Ask about fluid intake.
And then I asked if they have any problems with reproductive. I asked if they have any pain while urinating or anything like that. Next, I move on to the legs. I'll check the pedal pulses on each side to make sure they're +2 bilaterally, or if they're not, I can check for peripheral edemas on each side. Also check while doing this, I can check the general skin appearance, see if it's dry. wet, moist, or if it's red, normal, or if it's normal for the skin ethnicity. I then do the Homan sign on each leg, doing and ask if they have any discomfort.
Muscle tone.
Check both bilaterally, and then doing so I can also check for joint flexibility. Then I'll move up to the arms, back up to the arms. I check the radial pulses on each arm. While doing so, I check the capillary refill on both hands. I also do it on the toes. Don't forget that. I make sure they have good flexibility and mobility on each arm. And make sure that I can check the skin turgor on the back of their hands.
Skin breakdown.
Check back the hands. I double check skin color, see if the skin's got any rashes. If they had any, ask if they have had any recent surgeries that I hadn't assessed yet, or if there's any other rashes or of sorts anywhere.
About any numbness or tingling. I ask if they have any gait assistance.
Should be it.